So coming to the next section about hypopituitarism, we'll be talking about the causes. What are the etiological factors that can cause hypopituitarism in a person? So if we list a few of the causes of hypopituitarism, first being genetics, as you all know that there is a lot of evidence of genes being involved in any of the problem within the endocrine system. So genetics has a very important role. And then if there is a deficiency in the hypothalamic releasing factor. So as you all know, like I've mentioned before, that the hypothalamus is on top of the pituitary gland and it is connected to the pituitary gland with the help of a stalk. So the hormones that are released from the hypothalamus, it reaches the pituitary gland and then it signals the pituitary gland to release those hormones. But if there is a problem within the hypothalamus would not be sending signals to the pituitary gland, and the pituitary gland will not be releasing those hormones. So this could be one of the reasons why there is a deficiency in the pituitary hormones and thus called as hypopituitarism. Pituitary tissue destruction. This could be usually secondary to a list of things, one being the mass expansion. Second being infiltrative process. It could be because of any sort of infiltration. Any autoimmune or infectious diseases. We've got a list of autoimmune diseases. And then we have any sort of vascular accidents. It could be because of any aneurysm, being particular the carotid aneurysm. And then any sort of radiation injury, and lastly any sort of a trauma. So a trauma could also be one of the reasons why there is the loss of functioning of the pituitary gland and the release of hormones. If we talk about the most common cause of hypopituitarism in adults, it's usually the intracellular pituitary tumors. And other than that, if we talk about the paracellular masses that causes hypopituitarism, there's a list of diseases and masses that can cause hypopituitarism in this way. One being craniopharyngioma, and then we've got meningiomas, and then we've got any sort of optic nerve gliomas, teratomas, and then any sort of metastatic cancers and lymphomas. So these are the list of the paracellular masses that causes hypopituitarism. The second most cause of hypopituitarism in adults is the postpartum pituitary necrosis, which is usually in females, and it is called as the Sheehan syndrome. We'll be talking about Sheehan syndrome further in the lecture. And really, there are some infectious causes of hypopituitarism. It could be because of any sort of meningitis, any fungal infection. It could be because of any intracranial abscess, and the list could include tuberculosis, malaria, syphilis. So there are a lot of infectious reasons why we could have hypopituitarism. Lastly, if we talk about mutation of a PROP1 gene, this is the most common cause of hypopituitarism, which is present in congenital issues, and this is known as the congenital hypopituitarism. So these are the list of the causes and the etiological factors of hypopituitarism.